Hello, welcome to my channel. Today we'll be talking about safety, environmental hazards, accidents and injuries. This is part 2. Please note that I'm doing questions and answers directly from RN NCLEX examinations. Please hit the thumbs up. Please subscribe to this channel. Please share this channel with your classmates. Thank you. My first question: what do we do in the case of heat strokes? The correct answer: for temperatures up to 104 degrees, that's heat strokes, apply ice packs on arms, chest, neck, and immerse in cold water also. Next question: how do we take care of high altitude illness? The correct answer: for high altitude illness, we will return the client to low altitude, administer oxygen, administer steroids is the correct answer. My next question: what is a safe way to lift your patients? How do you safely lift your patients? The correct answer: maintain legs wide apart. Maintain legs with a wide base of support. Lift client towards you, not away from you. Always ask for help. Do not bend or twist your waist. Legs wide base of support is the correct answer. The next question: in an emergency, maybe there are multiple motor vehicle accidents along the beltway, we're going to have to triage our patients. What is the correct method for triaging your patients? The correct answer: we will triage our patients class 1, class 2, class 3, and class 4 triage. Class 1, high priority, life-threatening illness. Class 2, urgent patient with major injuries, not life-threatening for class 2. Class 3, minor injuries, not life-threatening. Class 4, these are your dying patients in an emergency. Next question: what should be our consideration when taking care of dying patients? The correct answer: patient needs privacy. Always close the doors, pull the drapes, always drape patient. The next question is: how do you apply heat packs? What should you consider when applying heat packs to your patient? The correct answer: do not place heat packs directly to skin. We're trying to avoid burns, especially in the elderly. You can just place it in a washcloth. The next question is: what is the jaw thrust head tilt. What is the jaw thrust, head tilt? And the correct answer, this is used in head and neck injury, head and neck trauma, for example in falls, maybe in motor vehicle accident, maybe client fell from a ladder. We will do the head and we will do the jaw thrust, head tilt. Next question. Child swallow poison. Child swallow poisonous material. What should we do? What should the teaching for the parents? The correct answer, when a child swallow poisonous material suspected, call poison control. Next question. Before applying restraints to a patient, what should we consider? Before we apply restraints, we should try, if your patient is confused, place your patients close to the nursing station. Offer patients PRN medications as needed for agitation and confusion. Restraint should not be applied for nurses' convenience. Restraint should not be applied for patients' convenience. If this does not work, we can also have a sitter to come and stay with the patient. If there's no sitter in the room, make sure your patients have a restraint on. We do not want them to fall out of bed. The next question. How do we document our restraints? When do we document our restraints? And the correct answer, when your patient has restraints on, maybe 2 wrist restraints, one on the right, one on the left wrist, or they may have 4 restraints, one on the right leg, one on the left leg. We will document every 2 hours when your patients have restraints on. What should we do when our patients are actually restrained? What do we do after we get the restraint order? You cannot restrain your patients without a doctor's order. Patients in restraint, we document every 2 hours. We ambulate them to the bathroom. Make sure they're voiding. Make sure we keep them hydrated, because if they have restraints on both arms, we are the ones who have to give the patients fluids. We will have to give them things to keep them hydrated. The elderly patients are at risk for urinary tract infections. One of the cause is due to dehydration. The elderly, sometimes they do not want to go to the bathroom often. They do not keep themselves hydrated. We have to offer them fluids. Patients in restraint, we have to assess their circulation, check for edema, check for blueness in the fingers. They have restraints on. Make sure you can put a finger through the restraints. Make sure they have good circulation. Make sure there's no edema in their wrists. The next question, patient is diagnosed with seizure. What would your intervention be? Correct answer, patients with seizure, keep the side rails padded. Patients with seizure, keep them in a quiet environment. No TV, no music, no telephone calls. Keep the telephones away from them. No TV. Keep the side rail padded. And make sure you have your seizure precautions outside the door that people can know that we need to keep this patient safe. What are our interventions for patients who are suicidal? The correct answer, patients who are suicidal must have a sitter at the bedside, not the family. A sitter from the hospital, nursing home, 24 hours. If the patient is not in restraint, if a sitter is in the bed, if the sitter is in the room, you have to remove the restraints. If there is no sitter, then you put the restraints on with a doctor's order. Do not forget, the beds, they have 4 side rails. 4 side rails up, that's a restraint. If your patient is confused, jumping out of bed, and if you put 4 side rails up, you have to get an order for a restraint. But suicidal patients, they have to have a sitter, one-on-one sitter, 24 hours. Make sure when you ambulate these patients to the bathroom, you go into the bathroom with patients who are suicidal. Keep all sharp instruments away from them, out of the rooms. Make sure when they are in the bathroom, you are in there. You don't want them to be killing themselves in the bathroom. What are your teachings concerning safety for your patients? The correct answer they are looking for, for the elderly, we are teaching them screening programs for vision and hearing for the elderly. We're teaching in the community fire prevention programs. We need smoke detectors, carbon monoxide poisoning. They need carbon monoxide detectors in the home. For teaching, we need drug and alcohol prevention teaching of our patients. We need to keep them safe. For our next question is about documentation for restraints. When you actually restrain your patients, what documentations do you do when your patient is completely restrained? When your patient, you have the restraint from the doctor, the correct documentation, the correct answer, you document alternatives. Well, I gave the patients PRN medications for confusion, agitation. That did not work. I placed the patients close to the nursing station. That did not work. I had 3 rails up. Then I had to put 4 rails up, which is a restraint. And these are all our alternatives we're going to document. We have to document the type of restraints. You will learn that there are various types of restraints in the hospital, but we'll start with the soft wrist restraints, and the soft wrist restraints and the ankle restraints are the same, soft wrist restraint. So we document the type of restraints. The time it was applied is important, and you document every 2 hours. You'll do your nursing assessment. You keep them hydrated. You will walk them to the bathroom to void urine. And most important, hydrate these patients. And you remove the restraints. Let them exercise their wrists, their ankles. Please hit the thumbs up button. Please subscribe to my channel. Please share this video with your friends. Stay tuned to part 3 on safety hazards, environmental injuries, and accidents. Thanks for watching. Have a good day.